know is right. So let's shine our light. Oh, let's shine our light. We won't listen to what they're saying. We know it's just love that we're giving to this place that we call our home. We can't change what's been done, but it's still our run. We are one with the world. We can make a brighter tomorrow. Together make a change. It's our life. We can't step back from what we know is right. So let's shine our light.
Super. Thank you, everybody, for joining. Welcome to Catalyzing Change Week 2024. I am hugely honored to be supporting this incredible panel. And thank you, Luann, and all the other speakers that are here that are organizing this panel. While I let people in, I wanted to give, for those of you who don't know what Catalyzing Change Week is, or what Catalyst 2030 is, I will give a quick intro. Catalyst 2030 is the world's largest social innovator-led network, and we are made up of over 4,000 social innovators from all over the world. What we're trying to do is build the sector, build the social sector, make sure that nobody works in silos. And Catalyzing Change Week is a week-long event where we do these sessions to make sure multiple stakeholders can come to the same table. They can, and there is plenty of opportunity for collaboration, conversations are initiated, and collaborative action is undertaken. So all of these sessions are super interesting to me. And if this is the only session you've registered for, please know that this is the week where we have over 100 sessions. So there's no way this is the only one that interests you. There will be others. So I will request you to please go on and sign up for as many sessions as you would like to. And if you're not part of the Catalyst membership yet, please do become a member. We would love to have you in the Catalyst 2030 family. I'm just going to share one quick video about the journey of Catalyst and Catalyzing Change Week. I hope you can hear me.
I am Sanjoy Roy, the co-chair of the Catalyzing Change Week Programming Committee. Welcome to Catalyzing Change Week 2024. This is where we'll not just have conversations, but we'll actually see change. We'll see change makers, innovators within the social space. You'll meet government folks and funders. You'll see people who've done excellent good practice that we can learn from. And most importantly, it'll be a place to network, learn, and exchange ideas. So do dive right in to the Catalyzing Change Week 2024 and enjoy the experience.
Thank you. And lastly, I just have a few housekeeping rules. We please request you to keep your video on if your bandwidth allows it so we can see you. Add your name and company and feel free to use the chat to interact with each other as much as you would like. Please stay on mute unless you are speaking so that none of the panelists are disturbed and everybody can hear super clearly. And if there's anything else, I'm here, I'm in the chat. Please feel free to reach out to me. And with that, I hand over, Luann, to you. Thank you so much. And over to you.
Thank you, Mishri. Thank you for the warm welcome. And good morning, good afternoon, and good evening from wherever you all are joining us from. Thanks for taking time out of your day to participate in this session on cooperatives as agents of systems and social change. I am Luann Werner, the Deputy Executive Director of the U.S. Overseas Cooperative Development Council, or OCDC for short. Now, OCDC is a member-governed organization based in Washington, D.C. that champions, advocates, and promotes for effective international cooperative development. We are members of Catalyst 2030 and delighted to host this session. Now, the word cooperative means different things to different people, and we expected the audience today to be a bit mixed. So before I continue with introducing our fantastic slate of speakers, I'm going to start with the basics and launch a quick poll. You should see it on your screen. The question is, what is a definition of a cooperative? If you don't see it on your Zoom screen, perhaps click the 3 dots to expand options, but please select the one that best matches what a cooperative is. I just wanted to ground us all before we go further. So option 1, a group of people that sign an agreement to get along for a shared goal. 2, a place where farmers bring extra produce to sell. Or 3, an autonomous association of persons united voluntarily to meet their common economic, social, and cultural needs and aspirations through a jointly owned and democratically controlled enterprise. I'm going to end the poll now, and we'll go to the next slide. You can see, oh yeah, we have the right audience here. Number 3 is indeed correct. Well done. We could have all of you come on and speak. I look forward to the conversation at the end of the presenters. Okay, so with the definition intact, we'll go to the next slide. Cooperatives can operate in various sectors. There are some, this slide shows some of the types of cooperatives that exist. Producer cooperatives, such as farmer cooperatives, consumer cooperatives, which can include credit unions, SACCOs, housing, utility, or grocery co-ops, worker-owned co-ops. Those are a type that our session speakers today are focusing in on. Purchasing co-ops, or those co-ops that provide shared services, or hybrid or multi-sector ones, which may provide a combination of services, include a combination of cooperative types. So now for a final poll question, not testing your knowledge, but just want to see who's here in the audience. Can you tell us if you are a member of a cooperative? I just launched the poll. And while you complete that, I'll go on to the next slide. So no matter what sector, all cooperatives abide by the 7 recognized principles. 1, voluntary open membership, democratic member control, member economic participation, autonomy and independence, commitment to education, training, and information, cooperation among cooperatives, my favorite, P16, and concern for community. And along with the 7 principles, they also have mutually agreed upon values of self-help, self-responsibility, democracy, equality, equity, solidarity. Now I'm going to close the poll and hopefully share it all with you. We have some cooperators in the house, well represented, and we have some future cooperative members listening in. That's great. Looks like 62% of you are cooperative members. So it's great to have you here. Now with the definition of cooperative set, it is my pleasure to introduce the speakers, all passionate cooperators with a wealth of experience to share. Barbara Zakorska-Jones is the Learning and Training Manager with International Cooperative Research Group, the research arm of OCDC. Johnson Andinda is a secretary of the recently established Uganda Health Partners Cooperative, a cooperative that formed out of a partnership with OCDC member health partners. Ashley Holst, who is the chief of party of Global Communities Cooperative Development Program, is here. Global Communities is one of OCDC's members. And Camila Pinheiro, the Cooperative Development Director at the National Cooperative Business Association, CLUSA, another OCDC member. As Mishra said, please feel free to engage in the chat. We may address some questions and comments as we go along, but there will be dedicated time towards the end for Q&A. Now, Barbara will kick us off to share some framing info on the transformative value of co-ops and help put the human face on cooperative data. Barbara, the floor is yours.
Thank you. Thank you. All right. Justin, will you be able to put up the first slide, please? I will get right into the activity that is very dear to my heart, the study of 4 different countries and 4 different contexts in which we tried at ICRG to find out what is the difference that cooperatives make. And the purpose of the study was not only to collect a numeric data and have a very concrete set of data to analyze. What we wanted to do was later on to involve colleagues from countries in which the study was conducted in a dialogue around the results, what it meant for them, how the data collected could be used to improve, invigorate the cooperative sector. And last but definitely not least was this identify impact on individuals. So the questions that we posed were really phrased like, what difference did it make to you as a cooperative member? What does belonging to a cooperative mean? When you move to next slide, please, I want to say a word about who participated in the study. So we had 4 countries, and in the sequence as the study was conducted, it was Poland, Philippines, Kenya, and Peru. And we had over 8,000 participants divided into almost equal subgroups, both members and non-members in each country. Those participants were randomly selected so that the perspectives of both members and non-members could be compared and validated. We had partnerships with local researchers to help us conduct the studies. We conducted the surveys. We then later discussed them with our local partners. We published the reports. USAID was the funding agency for all these activities. Next slide, please. So there are 2 important key findings that I want to share. The first one is that co-op members in all 4 countries, quote unquote, outperformed non-members. We compared income data as self-reported, of course, and as put on the national scale, averaged. And in all the 4 countries, the cooperative members reported higher incomes and higher level of economic standard. The next slide, please. The same was true for women as cooperative members compared to non-cooperative members. Again, in that comparison, we are talking about self-reported incomes, but it is important to notice that in both, we had those higher incomes and higher status reported by both members and women members. There is a lot more other types of studies and findings in our reports, and I welcome and direct everyone to both the individual studies and the global study across the 4 countries. But I want us to focus now on this one aspect that we have found extremely important. It is the focus on individual members. And I don't want to speak to Felicia. She is going to tell us herself what difference it made in her life, in her and her family's life, to be a member of the cooperative. Please run the tape.
I am Feli Ramos, 57 years old, a wife and the mother of 7 children. I am a teacher, a business owner, and a member of the first Laguna Electric Cooperative in the Philippines for the last 34 years. My husband and I came from poor families, but we have a dream. We dream of a brighter future for our children. This dream began to take shape when we became a member of our electric cooperative. My husband put up a tailoring shop with only 3 electric sewing machines as our tools in producing school and office uniforms. Our cooperative afforded us to give reliable electricity, which made the difference for us. Soon we were able to get big projects. Our biggest break came when we were able to supply the Scout uniforms in our provincial jamboree. Imagine supplying the Scout uniforms in these thousands of Scouts in the entire province. Then, as a teacher, I dreamed of putting up my own school. Again, this dream was powered by our electric cooperative, even installing a separate transformer for our school building. They had believed in our dreams, which was more than enough for us. We had opened our doors to hundreds of students for their learning. My family is now living in our dreams. We are able to do this while being a help to our community. God blessed us with a cooperative that power dreams.
Great. Thank you so much for showing that video. So do cooperatives make a difference? Yes, I think they do. And now with the study expanding, as you see, to 3 Central America countries, is getting the data to prove that the difference is made to the members and their families, to the women who gain agency, who are able to do more for their families, and what's important also to their communities, because this is being confirmed in the data that is coming out from the perspective of non-members very strongly. So I want to thank you all for the attention, and yes, we do make a difference, and we hope that cooperatives will be considered by everyone as a great way to involve the community members in whatever sphere of life that they want to participate. Thank you.
Thank you, Barbara. Thanks for laying the framework on cooperative impact. Next, we have Ashley Hull speaking and sharing some insights on her experience with worker cooperatives. Ashley, the floor is yours.
Thanks so much, Luann and Barbara, for that introduction. My name is Ashley Holst, and I have the pleasure of leading our cooperative development technical area for global communities, including our cooperative development program, which we call Clear Plus. I wanted to start by just giving a quick introduction to global communities and who we are and how we relate to this community within OCDC. We're an organization that's truly rooted in cooperative development. We were founded in 1952 as the Cooperative Housing Foundation and spent most of our formative years working in that sector of housing cooperatives. In 1997, we began implementing the Cooperative Development Program, which is funded by USAID, along with my fellow panelists here who are also cooperative development implementers. And over the years, we have implemented cooperative development activities in 8 different countries. One thing that has remained consistent throughout and is still true today is that at Global Communities, we work to apply the cooperative model to different sectors in order to find sustainable solutions to address economic shocks and support both individual and cooperative level resilience. So I am happy to follow Barbara because we were one of the organizations that was highlighted in the research study she spoke on. And I love these photos, which show cooperative housing in Poland in the early 90s and the opportunity to revisit those housing cooperatives later in 2018. So just showing how resilient and sustainable cooperatives can be. Next slide, please. So what is a worker cooperative? Luann mentioned at the beginning that worker cooperatives are one of the types that we all panelists are going to be speaking on today, and you may not be familiar with them because they are a more unique, slightly newer type of cooperative, but they're cooperatives none the same and rely on the same model, business model, and cooperative principles as the purchasing cooperatives, which were mentioned in the chat, and our agricultural cooperatives, which most of us are most familiar with. So in a worker cooperative, the employees, the workers, are the members. And what they are contributing to the cooperative is their time and their labor, which again, is slightly different than an agricultural producer cooperative where I might be bringing my goods to the cooperative. In this case, I am incorporating my time and my labor. A few examples that Global Communities has worked with in the past include tourism, mechanics, domestic labor like cleaning and childcare, engineering, transportation, and also utility delivery, which you'll hear quite a bit about today. In the chat, we will share a couple of links, including this video you see the image from on the left, which is a really informative short clip about how to form a worker cooperative. And I encourage you in your own time to take a look at that video and learn a little bit more about the worker cooperative model. One of the reasons why Global Communities has focused on this model in our project activities is because we really see it as an opportunity to focus on employment development and safe employment, especially for young people. Worker cooperatives are on the rise around the world. In the United States, we have nearly 500 worker cooperatives ranging from a number of different sectors, including healthcare and engineering, as I mentioned, but they're lesser known in a lot of the countries that we work in. And they provide a really interesting opportunity to expand employment opportunities in some of these emerging and high earning potential sectors. Next slide, please. So that leads me to our individual program, which we call Clear Plus, and it focuses on cooperative leadership, engagement, advocacy, and research. In this activity, we are working in Kenya and in Guatemala to scale up the worker cooperative model, particularly focused on those young professionals, the youth, who are very interested in using the worker cooperative model because it provides them an opportunity to utilize their entrepreneurship skills and build their own business that they are the owners of while working together. We have focused on a few sectors that we believe have high earning potential and also have a lot of interest from these types of young people who are interested in opportunities to better their communities and their own lives. I want to highlight the two cooperatives showcased in these photos. The top cooperative is Key Grow Recyclers. This is a group of young people who started out as a youth club, collecting scrap metal and selling it to the recycling center. And through their formation as a worker cooperative, they've really expanded their business model, leading up to having service contracts with other companies, purchasing 2 trucks to be able to provide both meaningful and safe, but most importantly, high earning potential jobs. I also want to highlight the other cooperative in the bottom photo, which is the Transparency Auto Workers Cooperative. This is a really exciting and interesting worker cooperative that has formed out of a group of young people who were studying to be auto mechanics at the university and decided to kick off their careers by forming a worker cooperative together. And through their formation, they have access to a garage, they can work together, they can share their tools like their diagnostics machines, which as individuals, they probably would not be able to afford. So I know, I don't want to take too much time, but again, we're sharing in the chat here some links where you can learn more about these two cooperatives in mini documentary series, but also sharing a curriculum that we are developing for worker cooperatives who are in their early stage development and the organizations that are providing the development support to them, focusing on business planning, financial management, and the relationship transparency between members and boards. I'm going to stop there, but I look forward to continuing dialoguing with all of you and talking more about worker cooperatives in the discussion. Thank you.
Fabulous. Thank you, Ashley. That was a great introduction to your work. And I'm going to pivot it now to healthcare in cooperatives. I'm excited to hear next from Johnson Ndinda about his innovative health cooperative work in Uganda. Johnson, the floor is yours.
Thank you, Luan. Thank you, fellow panelists. And I want to thank everybody who has joined to really be part of our session on the change that cooperatives can really bring about. My name is Johnson Ndinda. I am the board secretary of the newly registered Uganda Health Partners Cooperative. This is a special worker cooperative. Just like Ashley has been talking about worker cooperative, we are also a worker cooperative that is trying to advance and promote and strengthen healthcare through cooperatives. Next slide, please, Luan. And maybe I should say somebody on this call likes the panel. Dr. Jackie Malouf from Lebanon says she likes the panel of 4 women and 1 man. So it shows maybe women have taken over cooperatives, but that is okay because really our data shows that they are the majority users of cooperatives. So Uganda Health Partners Cooperative is a worker cooperative, which is among the very few that have been started in our country, Uganda. I come from Uganda in East Africa, and we started this journey way back last year as Workers Under Health Partners, Inc., which has an international development arm in Uganda, where they have worked for so many years. So that is our journey and where we are today. We are already registered. We've already had our first AGM. We have already put policies in place. We are building our website. We have transitioned staff from Health Partners Inc. to Uganda Health Partners Cooperative. And I'm currently the chief of party trying to oversee that transition from Health Partners to Uganda Health Partners Cooperative. So let me give you a brief background on the next slide, Luan. We really want to see that we can, build into USAID's localization agenda of having local actors lead the systems that donor-led development partners have been engaged in. So Health Partners started work here in Uganda 2.5 decades ago in 1997 to really create sustainable development through cooperatives. And they developed health cooperative model and have increased access to quality affordable care through this model, and we have seen members being protected. And now Health Partners is transitioning this work to Kenya. But as workers of Health Partners, we said this is something good that nobody else is doing in our country, and we have to continue and do it. So we registered as a unique worker cooperative, but also as a legacy for the work that Health Partners established way back. And we want to make sure that we can see more people, more cooperative members access care through health cooperatives where they pay very low cost premiums. They contribute these premiums, in a shared risk concept, and whoever falls sick is able to meet the cost of the care that they need without, first selling their family assets or going to borrow or, going to seek care on credit. So we want to make sure that as staff who have been leading this work as members of UHPC, Uganda Health Partners Cooperative, we can build the capacity of other cooperatives to add health care as one of the products for their members. Next slide, Luan. And so the work that we have done has really led to tremendous results in terms of improving health outcomes. We have seen members of cooperatives seek care earlier compared to non-members. Members are protected against high healthcare costs. In our country here, out-of-pocket expenditure is at 41%. And really, many people find it a challenge whenever they have a patient in the house and they are not members of a cooperative. And then members in cooperatives have, adopted preventive health behaviors because care providers who bear the risk cannot afford to, spend the money that they have been prepaid by members. So they instead invest in teaching people so that they can, live healthy lives. Then members of cooperatives are productive because they seek care early and they don't have to miss work or school if they are school children. And care providers who are earning, who are receiving the premiums have had their cost recovery, improved because they get payments up front and they don't have to, be running around with people who have not paid for the care that they have given, they have offered them. Next slide. And so over the years that Health Partners has supported this cooperative health development work, we have had 30 health cooperatives registered in the country now by the Ministry of Trade, Industry and Cooperatives. In the current project that we are implementing 2018 to 2024, over 35,000 members have accessed care through cooperatives, and they have really been able to improve their health outcomes. And they are being served by 68 care providers across the whole country. Initially, before 2018, Health Partners was working only in the southwestern region of our country, but now we are spread all over the country. We have influenced policy change. Health cooperatives have been added to the Cooperative Societies Act. We have had policies and regulations and bylaws about health cooperative and healthcare access through cooperatives added into our laws. And we have also a number of training guides and tools that really help cooperatives to manage their services. And we've been supported by USAID in all this. And most of the cooperatives are really female fluid. Up to more than 57% of the cooperatives membership is comprised of women. So Dr. Jackie, don't worry about the panel here. The results can show why. Next slide as I conclude. So as Uganda Health Partners Cooperative, we want to make sure that we can our goal is to strengthen locally led health cooperatives. And we are not doing this only in Uganda. We are doing it generally across Africa those who are interested in our services can be trained in, governance, leadership, and management. We can train them on, health insurance management, member engagement, increasing member equity and benefits. We build capacity in seeing that members can run sustainable health cooperatives, because the 30 that we are currently working with, really, we have some that have amazing stories that, they have made change in their community. Then we strengthen partnerships and networks, and we continue to engage with, policymakers to make sure that we can achieve universal health coverage in our country. Last slide, please. Oh,
I think that's,
I think that's it. So our services, as I've mentioned there, can actually be, given out on consultancy, or even, we can have an understanding with implementing partners and be able to serve them. Thank you very much. I'm glad to have been part of this. Back to you, Luan.
Thank you, Johnson. Thank you. And to all of our speakers, if you feel comfortable, feel free to share your LinkedIn profile or your email directly in the chat if anyone wants to follow up with more questions. But it has been a pleasure to watch your cooperative develop there in Uganda, Johnson. So switching continents, our next speaker, Camilo Pinheiro, will share about a women's recycling cooperative in Guatemala, sticking with the women's theme, I guess. So Camila, the floor is yours.
Thank you, OCDC Catalyst 2030, for organizing and for the invitation to be part of this session. And thank you for to all the people who are interested in this topic attending this session. Next slide, please. I just want to share where I'm coming from. NCBA CLUSA is the National Cooperative Business Association, formerly known as the Cooperative League of the USA. I know that's many acronyms, but it's a history of more than 100 years. And so a lot has happened since then, but since the beginning, NCBA CLUSA's mission has been the same, to defend, protect, and advance the cooperative model. And of course, a big part of our work here in the US is advocacy, thought leadership, education and training, and cooperative and community projects that we facilitate. And also another side, and you can see some of our members. And next slide, please. Another side of our work is our international development work, where we don't just work with cooperative and strengthening and promoting cooperative, although we try to do as much as possible, but we do other type of work in other areas, many countries around the world. So you can see where we have work and the reach and impact of our work. Thank you so much. Next slide, please. So very briefly, I just wanted to let you know, because we're talking about systems change, That's the topic of our session today. And we want to talk about these examples of primary cooperative, but we know that for systems change, you need the bottom and the top to meet. And so that's why I wanted to recognize the Cooperative Development Program funded by the US Agency of International Cooperation, because it allows us to do that, to work on the enabling environment. As you have seen, legislation is key for cooperative development. And it also allows us to work bottom up directly with cooperatives. And so this project we are implementing today is, in this cycle of the cooperative development, as global communities before, we have implemented many cycles of the cooperative development program. It has these 3 objectives. And now with a focus more on tools and sharing our learning. So you can check, I don't know if Luan is sharing the link to this project. You can check some of the work we're doing, some of the tools that we have developed with our local partners in these countries. And you can find out more about this project. Next slide, please. we, as part of the previous cooperative development program prior, we started supporting a group of women because other local partners like Asociación Atitlán, Lago Atitlán approached us because they were working with these women who were picking what they call waste material. And so there was the interest in making sure that they not only contributed to the cleaning of the lake, Lago Atitlán, but also it would help them improve their livelihoods and make it a sustainable activity for the environment, for the community, and the people who are doing this important work that many times is not very appreciated. And so because of their own interest, after we talked to them about the cooperative model, like it happens with the examples that have been shared before, this group of women, initially 63, decided to create a cooperative. The conversations, the training were with many more people, and these women represent around 1,000 people who do the work, but who haven't decided yet to join the cooperative. And these women are spread across the 13 municipalities that surround Lake Atitlán. According to many Guatemalans, it's one of the most beautiful lakes in the world. So another reason to really value the work that these women are doing to keep it clean. And so these women, they are spread around the lake, and they operate a network of collection centers where they is focused on solid waste so far. And next slide, please. With the support that we have given them so far has focused on the governance aspects of starting a cooperative. We know it's a lot of work, but it's worth it because it sets the foundations for the organization to grow and be sustainable. And so in the current CDP, we're focusing on making more on the business side and making sure that they increase their sales and their net revenue. They can continue to provide dignified employment to these women, as well as make sure that the cooperative growth adds value. You know, that there is a lot of processing that can happen with these plastics and other materials that they can sell for a higher value, no? And so that's what we are doing, and we are just here to bring their voice. So that's why we want to share this video in the next slide, where you can see them at work and hear some of their voices. Thank you so much.
Las mujeres de Atitlán Recicla son mujeres indígenas en la región, dentro de la cuenca del lago de Atitlán, mujeres que prácticamente día a día se esfuerzan por poder llevar el sustento a sus viviendas y buscan diferentes tipos de ingresos y de empleos para poder satisfacer sus necesidades. Atitlán Recicla ha sido una puerta y una ventana de oportunidades para ellas.
Esto ocurre en un contexto difícil, un contexto de triple discriminación, tanto por su condición de mujeres como por su condición de indígenas y por estar colectando material reciclable que culturalmente se considera como basura.
Forman 27 grupos de mujeres, en los cuales están 63 mujeres participando, con un total de mujeres indirectas de 956 mujeres. Y se han logrado evacuar más de 1.200 toneladas métricas, los cuales han beneficiado al medio ambiente en cuanto al manejo adecuado de residuos reciclables, pero también ha generado fuentes de ingreso y economía a las mujeres.
La cooperativa opera en 4 zonas de gestión, ubicadas en 13 municipios en la cuenca del lago de Atitlán, en los que concurren 3 culturas e idiomas mayas: cachiquel, sutujil y quiché.
Como mujeres tenemos ese derecho de poder participar y formar parte de una cooperativa. Es muy bonito formar parte de una cooperativa, viendo lo que es la legalización, pero ahora ya va a ser como una cooperativa legalizada, con sus estatutos, con sus reglamentos.
I think we passed the floor for some questions. Yeah, thank you again.
Thank you, Camilla. That was wonderful. I can't wait to see that lake in person sometime. Hopefully I'll get the opportunity. So as we pivot to the Q&A section, I want to put a quick plug for a link to an evaluation, which will allow us to better understand the audience we have here today. I just put it in the chat. We would greatly appreciate your time to share any and all feedback, and we will be sure and send this PowerPoint as a handout to all who complete the survey. So now looking at the chat, oh, I see a hand raised. Feel free to go ahead and take yourself off mute or type questions into the chat, whatever you feel most comfortable with. Yeah.
I actually prefer to voice my feelings at this point. I'm very inspired by everything we have witnessed at this time. And Camilla, you brought back memories. I lived 20 years in South America, and not in Guatemala, in Ecuador, but I have visited many countries from the region, and seeing this video, it touched me in the deepest of my heart. This is so inspiring. Not just because they are women, Johnson, but because it's really inspiring. And I have a question to you, Johnson, because I lead a diabetes organization. I'm a part of the International Diabetes Organization. I wanted to ask you, those who are member at the cooperative in Uganda, are they organizations, patient organizations? Are they medical societies? What are they exactly? Or small initiatives? I would like to know. But I also want to make a comment that I did put in the chat earlier, that maybe the sense of and the meaning of cooperative is different in different countries. They may be doing the same under a different name, you know? But yes, I would like to know about the members of this cooperative. And again, thank you all speakers. Very impressive and inspiring. Thank you. And Duan for the excellent moderation.
Oh, thank you.
Duan, can I come in?
Thank you. Yeah, I won't interrupt you. Go ahead and address that.
Okay, thank you, Dr. Jackie. I'm really glad to have met you here and for the question and the compliments. The cooperatives here really based on the cooperative principles, based on the cooperative values. They are regulated by the Ministry of Trade, Industry and Cooperatives, and they generally really follow these principles like any other cooperatives across the world. But in order for them to actually serve the members, and because they are offering services through an insurance model, it requires that people come together when there are many. So they come together in already existing associations. It can be farmer groups, it can be women vendors in the markets, it can be a school of children or big students, elderly students, it can be tea estate workers who come together through their maybe association or group and agree that they want to contribute to each other's health. And so they are registered as individual members in the cooperative or as an institution, and then they form a health cooperative, which is comprised of many groups with many members that join with their dependents. And so when they collect little premiums, this money becomes a lot and is put into one account or basket, and the care provider who keeps this money touches in that basket when members fall sick. Now, like the diabetes group that you're affiliated to, because it is a high risk, group, this pays more, 3 times more in premiums than other groups which are comprised of healthy and unhealthy people. But otherwise, if a group of diabetes or hypertension wants to join, their premiums or copay has to be higher. And, that is how they manage the risk. Thank you. I don't know whether that answers you, Doctor. Thank you.
It answered some questions and it raised more, but I'll stop here to give the floor to other people.
Please, let us get in touch and have a conversation outside here. Yeah, please.
Thank you so much.
I posted my email there. You can even reach out to me.
Are you on LinkedIn, as Luann mentioned?
No, but I'm planning to join. I will join.
Okay.
Thank you.
Thank you.
We will connect to you and maybe just quick to talk about what is a cooperative in different countries, and then I see Jacob has his comment too about finance and VSLAs. So cooperatives, they sometimes do have different names in different countries, especially I'd say with the financial cooperatives. There's mutuals or SACCOs. The principles are all the same, and I would, depending on the laws of each country, there is some organizations that operate just like a cooperative, but maybe they're not legally registered, and so we would maybe consider them pre-cooperatives. But yes, there is different names for them, and a lot of it does have to do with legal status and laws, and that's something else that OCDC and NCBA Cluso have worked on, is a clarity project to look at cooperative law and regulatory environments in different countries. So just want to make that plug to answer a couple people. I see Camilla, you have your hand raised, so why don't you, sorry, go ahead, go off mute.
Yeah, unless there are other questions, and I'm happy there is so much interest on health cooperatives, and actually I have a question about it, if I'm not interrupting any. I understand, I have worked closer with worker cooperatives, so that's why, but I think it's also a good question to make us reflect on the objective of this panel, to think about how a cooperative can contribute to systems change. And I was just curious about one bullet point in Johnson's presentation about what the Uganda Health Partners Cooperative is doing to advance the universal health care provisions, because I think that many times cooperatives are tasked with doing too much, and I think it's great when cooperatives reach out to the broader communities that are working to do systems change. And so maybe this is a good opportunity to talk about how cooperative can contribute to that system change by working with other partners for changes in legislation or in public policy. That's a question for Johnson. Sorry.
Yeah, I'm seeing him still on mute. I can't answer that.
Yeah. Thank you very much. There was some little shaking in my network, I think, but I think we have health partners that has established the work here for more than 25 years, and health partners is going to do the same in Kenya. And as workers, we saw that this is something that we really have to build on. Again, we don't have national health insurance in our country here. People who are on insurance are people who are working for corporate organizations. So the few community interventions that are trying to, offer health insurance to the informal sector mainly, and informal sector workers are not, as organized as the cooperatives are. So we see the cooperative approach really can bring about the system change in the way people are accessing services. And our parliament, our government is discussing the National Health Insurance Scheme. So we are trying to show them, look here, through the cooperative approach, you have people who are already members. We have over 12 million members in cooperatives in our country. And if the government can really accept to work with us, they would ride on this cooperative system to bring about a change in accessing care. So we think the cooperatives, especially our worker cooperative, working with already established health cooperatives, can bring about system change in addressing the universal health coverage challenge that we have at the moment. Thank you. I don't know whether Peniello, that is okay. Okay, thank you. Thank you. Yeah.
Great. And I'm gonna toss it over, maybe one response. Ashley, did you kind of want to respond to Jacob's question? Great.
Yeah, sure. I can respond to Jacob's question. Jacob was asking about informal savings groups, and how they may or may not tie to the cooperative sector. And I would say from my experience, they do have a very close link. In my experience, I'll speak to our program in Guatemala. We have Women Empowered, which is another project, and a number of women's savings groups and producer groups, more informal producer groups, have through their development have managed to work towards formalization or registration as a cooperative. I think the main difference, perhaps, or as they are evolving, is that from going from a savings group to a cooperative generally then includes some form of income generating activity. But I also wanted to add that a number of cooperatives that we work with choose as one of their member benefits to incorporate savings and loans into their cooperative. Sometimes this is called like a multi-purpose cooperative, and meaning that they're doing multiple things and providing different services to their members. But we do oftentimes see cooperatives adding in some financial services for their members, like a savings and loan program, especially so in our housing cooperative area. But I'll also add that a number of cooperatives then partner together. Kenya, for example, the SACCO sector is huge, and a number of cooperatives then form SACCOs or have a SACCO that they are in partnership with to give their members access to that savings and loan opportunity. So it's a great question.
Perfect. Brilliant. Thank you, Ashley. And with all the questions that came in, you guys are off the hook. I had some questions lined up to challenge all the speakers, but I think we're nearing the end. So and we're going to share a final slide that has resources that were hopefully all shared in the chat during the presentations today. I'm going to put another link to that evaluation in the chat. We thank you all for coming, and I hope this session helps spark some inspiration for all of you to help increase your participation and your collaboration with cooperatives as social change agents and as partners to help realize the Sustainable Development Goals. So as attendees, really, we encourage you to further share within your network the examples you have heard of how cooperatives are working towards greater systems change. Reach out to any of us with any follow-up questions. I want to give a special thank you to our speakers for their extra time today, and a thank you to Catalyst 2030 for allowing us to present, and we look forward to more collaboration with all of you in the future. Thank you so much.
Thank you so much. Thank you, Luann. Thank you, everybody, for joining. Make sure to sign up for more sessions. Bye-bye.
Thank you. Thank you.
Thank you. Thank you.